Learning ECG. 12-lead ECG comprise of 3 groups, 3 dipole limb leads, 3 augmented voltage limb leads and 6 unipolar chest leads. Leads I, 2 and 3 are the dipole limb leads and refer to recordings obtained from pairs of limb electrodes. Consider heart placed in a triangle and each vertex of the heart corresponds to the arm of the person. Right hand, left foot. Lead 1 is connected to the right hand and left hand where right is negative and left is positive. Lead 2 is connected to left foot and right hand where right hand is negative and left foot is positive. And lastly, lead 3 is connected to left foot and left hand where foot is positive and hand is negative. Now consider each side of the triangle as one lead and one end of the triangle is positive and other end is negative. So, now we have lead 1 as base of the triangle corresponding to base of the heart. Lead 2 is the right side of the triangle which corresponds to right side of the heart and lead 3 is left side of the triangle corresponding to left side of the heart. This triangle called as Enthoven triangle and is given by the formula. Lead 2 is equals to lead 1 plus lead 3, which means size of the QRS complex in lead 2 will be sum of QRS complex in lead 1 and lead 3. Now let us see these 3 ECG graphs. In lead 1 the amplitude of QRS complex is 1 big box, in lead 2 the amplitude of QRS complex is 3 big boxes. In lead 3 the amplitude of QRS complex is 2 big boxes. From this we can conclude that amplitude of QRS complex in lead 2 is sum of amplitude of QRS complex in lead 1 and 3, hence proving the Einthoven law, that is, the potential of any wave or complex in lead 2 of ECG is equal to the sum of potentials in lead 1 and lead 3. Unipolar leads are of 2 types, unipolar limb leads and unipolar chest leads. In unipolar limb leads, active electrode is connected to one of the limbs. Indifferent electrode is obtained by connecting the other 2 limbs through a resistance. Unipolar limb leads are of 3 types, AVR lead, AVL lead, AVF lead. In AVR lead, active electrode is from right arm. Indifferent electrode is obtained by connecting left arm and left leg. AVL lead, active electrode is from left arm. Indifferent electrode is obtained by connecting right arm and left leg. AVF lead, active electrode is from left leg, foot. Indifferent electrode is obtained by connecting the 2 upper limbs. Unipolar chest leads are also called V leads or precardial chest leads. Active electrode is placed on 6 points over the chest. This electrode is known as the chest electrode and the 6 points over the chest are called V1, V2, V3, V4, V5 and V6. V indicates vector, which shows the direction of current flow. Position of chest leads, V1, over 4th intercostal space near right sternal margin. V2, over 4th intercostal space near left sternal margin. V3, in between V2 and V4. V4, over left 5th intercostal space on the mid-clavicular line. V5, over left 5th intercostal space on the anterior axillary line. V6, over left 5th intercostal space on the mid-axillary line. Now, we will see ECG graph. ECG consists of graph and is divided into x-axis and y-axis. Each ECG consists of small box and large box. Large box is made up of 5 small boxes horizontally into 5 small boxes vertically. Each small box on x-axis corresponds to 0.04 seconds and small box on y-axis corresponds to 0.1 mV current. So each large box will correspond to 0.2 seconds on x-axis and large box on y-axis will correspond to 0.5 mV. Now let us see the complexes in ECG. ECG consists of P wave, QRS complex and T wave. Any wave above isoelectric line is called as positive wave and those below isoelectric line are called as negative wave. P, R and T are above baseline and hence are positive wave, whereas Q and S are below baseline and hence called as negative wave. Each wave has some significance. P wave signifies atrial depolarization, QRS complex signifies ventricular depolarization, and T wave signifies ventricular repolarization. The PR interval determines time duration between atrial and ventricular depolarization and the ST segment determines the time duration between ventricular depolarization and ventricular repolarization. We know that ECG has waves both above and below the isoelectric baseline. The wave present above the baseline are positive and the waves below the baseline are negative. Why does this happen? Let's understand. When depolarization current moves towards a positive electrode, it produces a positive deflection in the ECG, but when depolarization current moves in the opposite direction to the positive electrode, it produces a negative deflection. For example, let's see QRS complex in different lead leads. In lead like AVF and AVL, positive electrode is connected to the left side of the body, that is, left foot and left arm respectively. So whenever the current moves from SA node to left ventricle, the direction of the current is from right to left. So, the QRS complex produced in these leads is positive. Whereas, in the lead AVR, the positive electrode is attached to the right side of the body, and the direction of current flow is in opposite direction to the positive limb lead, hence, the QRS complex is negative. Similarly, in case of unipolar chest lead, V1 and V2 are placed in direction opposite to the current flow away from left ventricle, so QRS complex here will be negative, whereas lead V3, V4, V5 and V6 are placed in direction of the current flow just above the left ventricle, so they will be positive. In lead 1, 2 and 3 positive electrode is connected to the left hand or left foot, and hence the QRS complex is always positive in lead 1, 2 and 3. As the current generated in the SA node goes from right side of the heart to the left side of the heart, and the negative electrode is applied to right arm, and positive electrode is always attached to the left arm or left foot. So, current is always moving in direction of positive electrode in case of dipole limb leads. In lead AVR, positive electrode is connected to the right arm, that is, positive electrode is connected to the arm which is in opposite direction to the current flow, and no negative terminal is connected to any arm. So, the QRS complex here will be negative. That is, in direction opposite to the baseline. Similarly in AVL, the positive electrode is connected to left arm but at the level of current vector. So, the QRS complex here will be isoelectric or positive. Here in the image the QRS complex is isoelectric, it is not negative. Finally, the QRS complex will be positive in AVF, because of the same reason mentioned above. Now we will see chest leads. Here V1 and V2 is present opposite to direction of current flow in the left ventricle, hence, they are negative. V3 is present just above left ventricle and hence, it will be isoelectric, negative or positive. And lastly, the lead V4, V5, and V6 is connected in direction of current flow. Hence, they will always show positive QRS complex. Understanding rate and rhythm. Now, we can see the ECG on the screen here. Between two R wave distance is 4 big boxes. And one big box is 0.2 seconds, so the distance between two R wave will be 0.8 seconds. Which is equal to 1 cardiac cycle. Now to get heart rate we will divide 300 by no of boxes. In the above scenario we have 4 big boxes between two R waves. So, 300 divided by 4 is 75. That is, patient's heart rate is 75 beats. To end it on rhythm, let's see the first ECG. The first ECG shows the normal rhythm where the number of boxes between each QRS complex is 4 big boxes. Hence, the rhythm is normal. Whereas, the second ECG shows that the distance between the QRS complex is variable. The number of boxes is not the same. So, the rhythm is not normal.